Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
And I'm here talking with one of my colleagues, and she's going to introduce herself. If you're familiar with the Patients Program, you do know Miss Edwards, but now you know Dr. Edwards. So, Dr. Edwards, you mind introducing yourself to our viewers, our guests?
Thanks, Rodney. Hi, listeners of the world. I'm Hillary Edwards, Dr. Hillary Edwards. I use she, they pronouns, and last month I graduated from the University of Maryland, Baltimore Graduate School with my degree in health professions education. So you can do it all.
And if you're familiar with the Patients Program, i.e. work here, can do it all, it's right there under the bottom. There's other duties as assigned.
There you go.
It does a fantastic job for the Patients Program with us here. One of the earlier folks in the Patients Program years ago when Dr. Muller started, so she was part of the core of the Patients Program and helped me out a lot when I arrived 6 or so years ago. And I'm just excited for what you have, or what's in store for you going forward, Hillary, because your hard work doesn't go unnoticed, what you do here in the Patients Program. And again, kudos and congratulations to you.
Well, thank you so much, Rodney. Yeah, I think Dr. Mullins teased me that next year will be 10 years with patients. And yeah, where we have come, obviously this journey we haven't done alone. We've done with our colleagues that we've brought along and kept involved with us, such as you and Eric. And then also our patient collaborators and our patient advisors, where truly we would not be where we are today without those of us who have guided and held our hands on this journey.
You're talking about folks holding our hands, and folks who heard about the Patients Program probably have heard about PPA, the Patients Professors Academy. And those advisors, those advocates, those folks that Hillary were just talking about have definitely been a key component in year three. Year three of the PPA is upon us. We just closed registration actually early this week. So I know Joe is working hard behind the scenes, getting everybody acclimated and onboarding, and the curriculum is coming together. But there is a little difference about this year's PPA. Before we get into that, Hillary, let's talk a little bit about what the PPA is and how that has kind of shaped the curriculum or the approach to this year's curriculum.
Absolutely. So, as I mentioned, the Patients Program has been around for over a decade at this point, and we've developed such extraordinary relationships, not just here in Baltimore City, but across the nation with patients, people with lived and living experiences, other clinical researchers, funders, such as people from the Patient-Centered Outcomes Research Institute or the Food and Drug Administration, who have supported our work in the Community Academic Partnership. And over those 10 years, we've had people come to us for our support as well as that of our community partners. And we really decided a few years ago, we can lead the training for others to be able to do similar things.
Yes.
Same that we've been able to do by building trust and trustworthiness with community partners, meeting the community where they are, as well as meeting researchers where they are. And so the Patients Professors Academy was born. So in 2022, we built this 5-week online free program that is co-led by our patient advisors and content experts to really build out a training program in our 10-step framework for continuous engagement. So we have 5 weeks where you have a seminar. So that's co-led, again, by one of our patients' professors and someone such as myself or someone such as you, Rodney. And then we have deeper dive sessions where our participants are able to get into the meat, into the depths of the subject at hand, whether that's about how do you build out a community advisory board, or, what does implicit bias really look like when it comes to research and clinical care? That's actually the deeper dive that I'll be doing this year for 2024.
We're going to talk about deeper dives, and you talk about getting into the I would call it meat and potatoes of what we do when it comes to community engagement, what we do when it comes to the patients program and helping both sides of the equation. Because as an engagement specialist, when I describe who we are and what we do, I kind of talk about the community and then I talk about the research side. And when you talk about taking a deeper dive, I think it's important for our listeners to understand that we don't do that alone as the patients program. We don't say, okay, Dr. Edwards and Michelle and Dr. Moses, they know all the answers. They have everything. Now, don't get me wrong, they have experience, but when you have help, assistance, or guidance from other advocates or community members, how important is that to deliver the message together as a unit? How important is that?
Well, certainly I can't do my job without the people in the community who are guiding me in the work that I'm doing. So from the beginning of not only the Patients Program, but the development of the Patients Professors Academy, it has been co-designed, co-implemented, co-shared with our community partners and our patients professors. And so, from the application process. So Rodney, you are interested in attending the Academy this year. You submit an application. Your application is reviewed by 5 of our patients professors, those who have worked in collaboration with our program, those who have graduated from our past years of the Academy. They review every application to see, what is it that you are bringing to the table and what is it that you will be getting out of the Academy. And that helps us not only shape our cohort, right? Because they know what it's like to be in collaboration with an academic researcher. They know what it's like to work with a clinician who's working in the patient-centered outcomes research space. And so they help. And I got to say, every year I say this is the best cohort yet, but this year our class is going to be truly incredible. And so it's really just such a joy to be able to walk with our community partners in building this program. And they're the ones who hold us accountable to ensure that at every step of the design, of the delivery of the curriculum, of the continuous engagement that we do in the professional development opportunities we offer our patients professors after they graduate from the program, they truly are aligned with the priorities, the desires, and the professional goals of our patients professors community.
I will say that when I'm out in the community, whether it's at a health fair or whether it's a meeting I'm attending representing the patients program, I get tons of compliments on the work that we do. And we literally take that co-develop, that co-partnership where people really see that in the work that we do. So that makes me feel good that folks understand a little bit about how the patients program works, whether it's from the engagement team or whether it's from dissemination, or whether even it's from program development, project development. And when we talk about PPA, there's a component about the Patients Professors Academy that is, again, talk about those deeper dives. We talk about our Summer Roundtable Series, where we have these deeper dives. We have these breakout sessions, and you could be in a room or a group or a Zoom box with a researcher, a nonprofit organization, a member of West Baltimore community, someone who's logging in all the way from Kenya, who's doing some work over in Kenya because the patients program has grown nationally because of the PPA and other efforts here at the patients program. But there's a specific topic or theme that you develop, and it's titled Asterisk. And I'm going to read what that means, because that is one of those.
We love to create acronyms for very long sentences to describe the research that we do in health services. Absolutely.
Yes.
Go ahead. Tell me what Asterisk is, Rodney. Or tell the world.
As I defer to my other screen over here. Asterisk is an acronym for Addressing Systemic and Structural Racism to Improve Safety, Quality, and Trustworthiness in Health Delivery Systems. Tell us a little bit about Asterisk this year, sponsorship, and then what you plan on or what you would like to see out of that this year.
Sure. So one of the great things about the Patients Professors Academy is we bring together this incredible group of diverse and inclusive learners to talk about things like health equity, continuous engagement, trust and trustworthiness in health services, whether that's clinical care or research. So we have a really captive audience. We also have a lot of people who have a lot of things that are going on in the summer and can't commit to a 5-week training program. Or they find out about the academy after the admissions process closes or after the academy has started. They find out from a friend who's in the program how they want to get involved. So when we started the academy, we also would run at the same time in the same summer schedule our Summer Roundtable Series, which isn't funded by the same mechanisms as the Patients Professors Academy, but is an opportunity to bridge the learnings that are going on during the academy with our learners with some of the larger critical issues and with a more diverse, sort of low-hanging opportunity to engage in conversation around critical issues in health equity. So that's what started our Summer Roundtable Series. And then we said, well, since we're running this program, we're bringing in national experts in clinical research as well as lived experiences. Let's find an opportunity to have funding to really make our Summer Roundtable Series even better, to level it up, right? We never stop leveling up in this program. And so I submitted a proposal to one of the federal funding agencies called ASTARISQ, or the Agency for Healthcare Research and Quality. ASTARISQ actually is the original funder for the Patients Program. It is the original federal agency that gave us that 5-year, $5 million grant in 2013 to get us started.
Oh, yeah.
So we went back to them and said, hey, we want to fund the Summer Roundtable Series, and we want to focus specifically on structural racism and structural oppression that occurs in these health delivery systems. And how do we address the infrastructure issues to improve patient-centered care, patient-centered research, et cetera? So we submitted our original proposal to ASTARISQ in 2022, so after our first year. It got scored, so that means that they thought it was a good proposal, but it wasn't funded. And I said, screw it, let's run it anyway. So I took that proposal and essentially did a proof of concept last year for 2023. And I believe that that page is still available on our website. Our YouTube channel has the playlist of our Roundtable Series in 2023. So we took our Asterisk theme and we ran it last year and then submitted again and said, not only do we still think this is important, but here is how we did it without funding. And then ASTARISQ was like, all right, fine. Like, we'll fund you for 3 years. And so we have 3 years of funding from the Agency for Healthcare Research and Quality to run Asterisk. And, you know,
hold on.
Yeah.
I'm going to stop you 1 second just to catch folks up to what's going on, see if they're listening here. So you had an idea that was something that ran parallel with the Patients Professors Academy. It also was a free opportunity. So if I kind of correlate this to if I'm in a class and then there's a TA, a teacher's assistant, that's kind of giving you study hall hours or making themselves accessible to kind of break down what's being taught in the main class or the main PPA, now you can come to TA sessions and get quality information broken down into a language that you understand. And that, again, runs parallel to what the PPA is doing. And when you first went to get it funded, get it paid for, so to speak, they didn't like it. They didn't believe in it. Now, we don't think that's worthy enough. You did it anyway. I call that shooting for the moon. And if you miss, at least you're amongst the stars. Mm-hmm. So you shot, you missed. And now you went back and had evidence showing that it worked. And they not doubled down, but they tripled down on your idea and gave you 3 years of funding to, again, provide another opportunity for folks who didn't necessarily get an opportunity to register for PPA, but wanted to learn a little bit more about what the Patients Program is doing when it comes to, improving health delivery systems. So that's where we are right now, right?
Yeah. So let me talk a little bit more, too, about our 3-year sort of vision, which really has to do first, right? It's about awareness, sort of activation, and then evaluation. So you can't change a problem that you can't see. And so much of our health delivery system has roots, unfortunately, and root causes in health disparities.
Yes.
And we talk about that, right, in our program and all these things. And on one hand, that I often think about one of the quotes that has stuck with me for the many years I've been with this program is with one of our longstanding community partners, Juwan Monroe, who doesn't believe in the train and pray model when it comes to training, right? So I don't want to just have a webinar series where we talk about structural racism or the issues of health disparities in clinical care. I want to lift up the voices and the actors across this country that have really been doing the work in their systems to address these issues, and then provide them as models for others to know that they too can do similar things.
I like that, Hillary, because right now what you're talking about is not just checking your box. You're checking your box, you're meeting the community where they are, you're helping them, you're assisting them, you're guiding them, you're giving them templates to take what we're doing here in Baltimore. But again, it's something that can be, I'm not going to say mirrored, because Baltimore and Chicago is not the same. They have some similarities, but they have similar situations. So you are finding a way, or have found a way, to give folks the tools that they need to attack issues that are going on in their community.
I like to think of myself specifically for Asterisk as more of a matchmaker. One of the things that I know I struggle with, it's one of the parts of my job that I end up procrastinating on, is the communication and dissemination or sharing of the things that we're doing. Patients Professors Academy does that for me, right? We are teaching others our model, and they're implementing that where they are. My goal with Asterisk is to do something similar, of take, for example, the group that's working in health equity at MedStar, which is a huge health delivery system in the United States, and give them a platform to discuss the challenges in addressing patient safety and quality care, what they've implemented within their organization and across their organization to impact inequities and address racial inequities in the clinical care, clinical delivery that they're providing. And then what are the tools and resources that they can give to others who maybe are just starting on that journey to be able to address those barriers themselves? I don't have the answers. I don't work in a hospital system that is, has 50 locations across the United States, but I can bring those people together to really talk about how they are solving these problems in real time. And that's what I'm trying to do with Asterisk, is it's not just lift up the voices of the patients program and our patients professors, but it's identifying the people who maybe have prioritized the work over the sharing of the work, so that they have a space to come together and talk together about the solutions that they've developed, so that then others can, again, whether it's in real time during the Summer Roundtable Series, or go to the patient's YouTube channel and be able to see, wow, here's a system that is like our system, and we can take some of the lessons learned from their senior administrators who've dealt with these issues of addressing the barriers to patient safety, quality, building trustworthiness. And so every week of the 5 weeks of the Academy, so again, between July 15th and August 14th, we're going to be running our Summer Roundtable Series. The first one, which is July 17th, is on structural determinants of health, right? So What does that actually mean? We talked about addressing, structural racism, but what are structural determinants of health? And how has the historical, systemic, structure, political influences impacted individual health and community health? And so we have people, again, from across the United States, whether that is Melanie De Silva, who's the co-director of the Pregnancy and Child Health Research Center at Health Partners out in Minnesota, and Vulan Foster, who is the founder and executive director of Life After Two Losses. She runs a nonprofit that's based on the East Coast to help birthing individuals on coping with pregnancy, loss, and miscarriage. Then we also have Melissa Moorhead, who's the co-director of Data Across Sectors of Health. And so that DASH is about addressing data modernization. How do systems talk to each other when I might be receiving my primary care in one place, but might be receiving my women's health care somewhere else? And how does that data talk to each other so that I can get the best care? So those are the types of individuals that we are bringing together for every session from their different lived perspectives, their different lived experiences, and their professional expertises to address these issues that are systemic, right? Structural racism, structural oppression, structural determinants of health. It's universal. It's a universal issue, and many people have interacted with it. So how do we bring those voices together to come up with a solution and share best practices and promising practice together?
This program is located here in Baltimore, but when you mentioned working with partners in Minnesota, up and down the East Coast, folks who are advocates for different groups, this is by far way stretching the reach of the patients program. Dr. Mullins has always had a goal to increase the patients program reach and quote unquote go national, so to speak. So kudos to you, Hillary, for figuring out a way to assist in that. I know Asterisk has been your baby, so to speak, as far as you putting a lot of work and time and sweat equity into connecting these groups and having folks together to run these roundtable sessions. And when we talk about co-creators or, co-leaders, how important is it for you to, again, develop this format with someone else or with other groups? That's really important to you. How important is that to you?
Obviously, couldn't do it without them. I think also we talk about this a lot when it comes to equity and fair value. And we spend a lot of time working with our patients' professors, especially around compensation, which is not necessarily just financial. It could be other resources, right? How do we make those deposits into the community? Who are the credible messengers? And, last year for 2023, we ran Asterisk without a large funding stream. And so it was really on the faith of us working together to do something special, hopefully to get funded for future years, right? Hooray. But we didn't know that last year. We just thought this was a really important topic that needed to be addressed. And a lot of people...
That's the shooting for the moon part.
Shooting for the moon. And so, I reached out to Jared Walker, who's the founder of $4, which is a national nonprofit that helps individuals, no matter where they are in the United States, navigate charity care resources where they are receiving care. Every hospital in the United States must provide charity care, but believe it or not, most of those hospitals make it very difficult for people to know what financial resources are available to them when they get that bill in the mail, whether or not it was covered by insurance or just happened to see a doctor who wasn't part of their network. So I had actually seen Jared's information on, I think, NPR. I had been like, oh, that seems like a cool organization. So I just reached out to him. I said, hey, Jared, I'm building the Summer Roundtable Series. We want to talk about affordability and accessibility for patient care in the United States. Would you be interested in participating? And he was like, count me in, right? And he's coming back this year to serve on our panel for whole person healthcare, which is Wednesday, August 7th. You're right. And so I think that's something that also tells me that not only the topics that we are discussing are important and people want to be part of that conversation, but I think also the recognition that we have to do this together. Mm-hmm. It's not just the patients program who can advance solutions for health equity or for breaking down those barriers to affordable and accessible healthcare resources. It's us being in conversation together. And that's something that I really get a joy out of. I am not a subject matter expert in whole person healthcare or in improving healthcare delivery, but I can help bring people together to have a really meaningful conversation around that. And that's what excites me about Asterisk, is it's about the conversation that people are coming together to share those challenges, to share the celebrations that they've had and what they've been able to do. And then how do we share that with the audience, right? Not just the members of our Patients Professors Academy, but to the CEO of a health system based in, Texas.
Yep.
Who maybe is struggling to figure out how does he or she get their senior administrators on board to come up with a better online portal for charity care, right? And so sometimes we won't know the impact that our voices have in sharing our stories will have on others. But I believe that we are making an impact because, again, who is applying to our Patients Professors Academy, or who's saying yes to serve on the Roundtable Series this year? And then when we think about 2025, who are some of the individuals who maybe attended an Asterisk webinar for the first time, or maybe saw our information on YouTube or listened to the Bridge podcast, who then say, hey, we really want to talk with you because we want to make changes in our organization, and that it's not just copy that's part of marketing, but it's truly structural, systematic addressing of bias within their organizations and coming up with solutions that are meaningful, not just for the patients and the communities that they're serving, but for the people within their organization as well, from top to bottom or bottom to top. They know that their organization truly believes in a more just, a more equitable, a more accessible, a more affordable healthcare delivery system. Mic drop.
It might drop. Boom, snaps here. The Patients Program, when we hear someone, whether it's internal or external, share a jewel, we usually snap. So, great message, Hillary. And you coined yourself not necessarily a matter expert. Okay, I get it. Dr. Edwards, okay, you don't want to be called doctor. Okay, cool, I get it. But what I do know about you is, and you said it as well, you are not afraid to get people together to talk about a subject matter. You provide a platform for folks to talk about a subject matter. I've sat in meetings with you with different various projects, and you are not shy about encouraging folks to speak up in a group about a particular subject matter. And this is what Asterisk is. This is what the roundtable sessions are. You have cold called folks, the CEOs and professionals all over the world, and they've got back to you or even agreed right there on the spot to participate in or with the Patients Program. When you talk about the preparation and talk about what went into it, Patients Program is a national program. It's the PPA has been sponsored by one group, and now the Roundtable sessions are sponsored by one group, not for 1 year, but for 3 years. So we can look forward to more of this. Talk to us a little bit about what have been some of the challenges you had to work through, and then give us a couple jewels and nuggets about some of these success stories.
Sure. So when I think about the challenges that we've faced, first, it's logistical, right? I recognize that I'm not going to reach everyone through an online platform because that's not the way that many people get information. And the balance of how do we create something that's accessible while also, in this case, efficient, because there's only, one of me. There's only one patients program. There's only one funding stream that we have to support this work. But we can, again, bring together people and finding the balance between open-ended conversation and focused objective. So the first year is always the hardest because you're building the plane as you're trying to fly it. I think that's what it is. Or maybe it's flying the plane while you're trying to build it. But we really tried to keep the roundtables very open-ended, which was great. A lot of really rich stories were shared. But I don't know if people walked away from each session with a particular nugget of information or a specific resource that we wanted to make sure was shared. Mm-hmm. So what I'm trying to do this year, working in collaboration with each of the roundtable panels, is in our prep sessions, answer 3 questions. What is one part of your story that you want to be shared? What is one resource you want individuals to take away from the session? And what is one thing you want to learn from each other? And by having a structure for still open dialogue, but a consensus of these are the 3 most important things, it helps ground and anchor a conversation, not in the dissimilarities, but in the shared objective of what we are coming together, again, in the round table where everyone has an equal voice, to come up with a solution or to share, while nonetheless having the diverse experiences of the lived experiences of those who are attending the table. So I think logistics, because this is the third year, we have overcome some of the Zoom challenges that we've had. For better or for worse, the logistical challenges, I would much prefer to deal with those than someone being really unhappy or feeling offended in a session. I feel fortunate that, again, we've created brave spaces and courageous conversations for people to talk about issues that are hard and that a lot of people don't want to admit to. A lot of people don't want to admit to having implicit biases, but that's just the world we live in.
Yeah.
Unfortunately. And so if we can create spaces where people can say, I recognize that this system was built with implicit bias, and I'm here to be brave and courageous in trying to address it meaningfully with the other people who are in my institution, other people who believe that this is an important cause to address, and with the people who are not served justly or equitably in the system, and we can bring them in to unpack and rebuild. That's, again, what feels good for me of the successes, is that we have many of our speakers from last year who not only said, yes, I want to come back, but then they gave me 3 or 4 other names of people who they thought needed to be part of the conversation. I think about some of the logistical challenges that maybe we've had in the past that I didn't even know maybe I was going to face, and having our patients professors, one who actually just called me on the phone. I never get phone calls anymore. I always just get a text or an email. But one of our patients professors, after our registration page had gone live last year, called me up and said, hey, you don't have a question in your registration form about accommodation. And if you're trying to make sure that your webinar series is successful, you need to include a question about accessibility. And I was like, you're right. I didn't, again, that was a very, unfortunately, like ableist bias that I had. I didn't think about putting that box in because I was like, well, of course we're going to have transcription services and closed captions in on Zoom. But they didn't know that. And so those are some of the things that, again, I wouldn't call it necessarily a challenge, but how grateful I am that we can have those conversations in real time, and our patients professors aren't scared or intimidated of saying, oh, well, they posted this website, so they might not care. They're like, hey, you need to add this to your registration page. And I was like, I'm doing that right now, right? And we fixed it within 30 minutes of, and that demonstrates, I think, again, our commitment to collaboration, co-development, that it's not, and that, it was my mistake and I didn't have a universal design mindset front and center. And so those checks and balances are critical to ensuring that we as the Patients Program and me, Hillary Edwards, we are living up to the promises and the visions that we have for co-collaboration, co-design, co-implementation, co-evaluation, co-celebration of all this great work that we do together.
Well, Hillary, Dr. Edwards, thank you for this. And I will say this, I won't get on a plane that anybody's building and is not built yet to fly anywhere. But I will join you as you continue to increase the reach of the Patients Program, provide platforms, safe spaces for folks to talk about issues that they may not have the space to talk about. And I've been a part of some of these conversations, and they've been very, very, very vibrant. Folks have left with jewels. Here on the bridge, Eric and I, who are behind scenes, we've gotten calls and we've interviewed some folks who have participated in PPA sessions before, and they speak highly of their interactions with you, with Joe, with other guests as well. And the PPA Summer Roundtables are a fantastic opportunity for folks who want to learn a little bit more about the Patients Program, about increasing health equity, and again, being in a space where they can talk freely and talk safely. So that is something that I'm excited about for this year. Again, your efforts have not gone unnoticed. Providing spaces for folks to talk about things that they don't talk about is why Patient Professors Academy is in high demand, which is why our summer roundtables are attended and even proctored and ran by folks who are eager to work with us. I think that is definitely one of the things when we talk about a success story. How do you measure that, right? Do you measure it by folks who attend? Do you measure it by what impact that they have on their environments? And the countless emails, messages, bridge requests to come on our show and talk about it. So for folks who want to learn a little bit more about past summer roundtables, about this year's summer roundtables, do you mind sharing where they can find that at here? And then we can put that in our details within this recording.
For more information on the Patients Professors Academy and to register for our Asterisk Summer Roundtable Series, they can go to patients.umaryland.edu, our main website, and you should be able to navigate on the left-hand side to our different initiatives, again, whether that's the Patients Professors Academy or Asterisk, where you can find all the information on the date, the panelists, the scope, and hopefully more information about our program as they want to get involved with our work.
Awesome. Fantastic. Dr. Edwards, it was a pleasure.
Always a pleasure to be with you, Rodney.
Thank you, and thank our listeners as well.
Thank you so much.
Thank you for listening to The Bridge, your health, your voice. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.
Be sure to join us for our free Summer Roundtable Series to be held online starting Wednesday, July 17, 2024, and running until Wednesday, August 14, 2024.
I don't want to just have a webinar series where we talk about structural racism or the issues of health disparities in clinical care. I want to lift up the voices and the actors across this country that have really been doing the work in their systems to address these issues, and then provide them as models for others to know that they too can do similar things.
These 5 sessions are lively discussions with content experts about topics such as structural determinants of health, overcoming systematic oppression, improving healthcare delivery, and more. The series is free, but you must register. Go to our website and click on the Patients Professors Academy tab to register for the roundtable.
But it's truly structural, systematic addressing of bias within their organizations and coming up with solutions that are meaningful, not just for the patients and the communities that they're serving, but for the people within their organization as well. From top to bottom or bottom to top, they know that their organization truly believes in a more just, a more equitable, a more accessible, a more affordable healthcare delivery system. Mic drop.
Mic drop. Boom. Snaps here. The patients program.
I am not a subject matter expert in whole person healthcare or in improving healthcare delivery, but I can help bring people together to have a really meaningful conversation around that. And that's what excites me about Asterisk, is it's about the conversation that people are coming together to share those challenges, to share the celebrations that they've had and what they've been able to do. And then how do we share that with the audience, right? Not just the members of our Patients Professors Academy, but to the CEO of a health system based in, I don't know, Texas.
Yep.
Who maybe is struggling to figure out how does he or she get their senior administrators on board to come up with a better online portal for charity care, right? And so sometimes we won't know the impact that our voices have in sharing our stories will have on others. But I believe that we are making an impact because, again, who is applying to our Patients Professors Academy, or who's saying yes to serve on the Roundtable Series this year? And then when we think about 2025, who are some of the individuals who maybe attended an Asterisk webinar for the first time, or maybe saw our information on YouTube or listened to the Bridge podcast, who then say, hey,